Hi, this is Anjela, holistic medical herbalist. Welcome back to our series Stop the Inflammation Pandemic. In our last episode, we journeyed through the gut, where so many of our health issues begin. We followed Mr. X and saw how gut inflammation is tied not just to food but to stress, emotions, and lifestyle. And we introduced some powerful herbal combinations to support healing. But today we are heading up and down into the respiratory system. That is right, from your nose and sinuses all the way down to your lungs. The air we breathe and how can it spark inflammation? Let's think about it. Every breath we take brings the outside world into our body. In a healthy person, if dust or pollen enters the nose, it gets gently washed out by the mucosal lining, that soft, moist layer protecting your airways. But what happens if that lining is dry? Now the pollen or the dust sticks and your immune system senses it and wants to get rid of it, so it makes you sneeze. And if that didn't get rid of it, it causes runny nose. In the process, it irritates the lining, especially if it takes time to shift that dust. What starts as a normal reaction can spiral into a chronic inflammation, especially if this cycle repeats over and over. If that irritation travels deeper into the sinuses or into the lungs, then your body escalates the response. What it does is it makes phlegm, not because it wants to annoy you, but because it's trying to trap and push out whatever got in. And here's the twist. Your immune system starts seeing the pollen or dust, the harmless things, as dangerous, so it attacks. And that is how a sneeze can turn into chronic sinusitis, or a mild cough becomes bronchitis again and again. Acute versus chronic inflammation. What is the difference? Let's break this down. Acute inflammation, like from a cold or a flu, usually clears up within a day or two, maybe a week. Sometimes you need antibiotics, sometimes you don't. The body deals with it. But chronic inflammation, that's when the immune system won't turn off. Even after the infection is gone, it keeps attacking. Or it gets stuck in a loop from repeated infections because your immunity is too low. Nowhere else was this clearer than during the COVID pandemic. Many people got over the virus in a week, no fever, no body temperature anymore, no aches and pains, but suddenly by day 10, day 11, lung problems, heart inflammation, blood clots. Why? Because the immune system overreacted. It was already tired, already dysregulated, and instead of helping, it attacked the body's own tissues, especially the smooth muscle lining. That's how people with autoimmune conditions and the elderly ended up suffering the most. The immune system couldn't regulate and come back to normal. It went into overdrive. Now, what about you? How is your immune system keeping up? Let's do a quick check-in. If you get a cold or a flu once or twice a year, bounce back in a few days, no meds, great. Your immune system is doing its job. It's creating memory cells for the new variants we are exposed to every year, our own vaccine. But if you're getting sick every couple of months and it lingers for weeks and you are needing antibiotics, steroids, or you just feel like you never quite recover, that's your body saying, I need help. I am trying, but I am overwhelmed. So what can we do? We need immune modulation, not suppression. We don't want to shut the immune system down. We want to modulate it. To fight off real threats like viruses, bacteria, or even cancer cells, we want it to be alert and functioning well, but not to attack our own tissues or our breakfast. And here's the good news. Your body knows how to find balance. You just need to give it the right support. So what dietary support we can give? To start with, Cut out wheat, dairy, yeast, processed foods, and hybrid grains. Add in red and purple color fruits and veggies. They are full of antioxidants that calm inflammation and help you repair your cells. And with the herbal remedies, the core remedy, we should go for Marshmallow Root Plus, which is a combination, soothes and protects the entire respiratory tract wherever smooth muscle lining is present. For the upper respiratory tract, which is the nose, sinuses, and the throat, Elderflower Complex, which helps to clear mucosal lining and sinuses and help reduce inflammation. For the lower respiratory tract, bronchioles, and the lungs, the Lungwort Plus, it thins the mucus and removes it from the body and also helps to heal and strengthen the lungs. Got issues in both areas, you can combine them. Take them daily with your elimination diet for at least 3 months to see solid results. Important reminder, if you're on long-term medication like steroids or immune suppressants, please talk to a holistic medical practitioner before starting herbs. You want safe, tailor-made support that won't interfere with your current treatments. Let's breathe into healing. Your breath is sacred. Don't let chronic inflammation rob you of your vitality. With the right diet, a little bit of herbal help, and a body that knows how to heal, you can reduce respiratory inflammation, restore immune balance, and start feeling like yourself again. Thanks for watching and stay tuned, because in the next video we are going deeper into the inflammation puzzle, one system at a time. Let's keep healing together.